Hello and welcome to Natural Cycles virtual panel, which is all about unpacking birth control in 2020. I'm Kat Harvey-Jenner, features editor at Cosmopolitan UK, and I've spent a lot of my career writing about women's health issues. Contraception is obviously a really big part of that, but despite this, and also despite the fact I've been on hormonal contraception myself for years, I still seem to learn new things about reproductive health and birth control all the time. So that's why, with World Contraception Day coming up, Natural Cycles wanted to share the love and host an open conversation discussing all things birth control. It's so important to know as much as we can about our bodies, what we're putting into them, and how they work, because that's how we know when things aren't right. And let's face it, the more you know, the smarter the decisions you can make for your health. So today, I'm joined by three brilliant panelists who are going to share everything they know about the myths, the truths, the present and the future of contraception. So without further ado, let me introduce our experts today. First up, we've got Elina Berglund, co-founder and CEO of Natural Cycles. Elina, if you want to introduce yourself.
Hi, welcome everyone, and thanks for joining our panel. For us, since Natural Cycles is the first and only FDA-cleared birth control app, World Contraception Day is very important and something we celebrate a lot. Personally, I'm originally a particle physicist before I founded Natural Cycles together with my husband, much because there needs to be more options out there when it comes to birth control methods.
Next up, we've got Dr. Revée. She's a naturopathic and functional medicine doctor. So Dr. Revée, take it away.
Hi, thanks everyone for joining us today. I'm Dr. Revée. My full name is Revée Barbour. I'm a naturopathic doctor, so I have an ND instead of an MD, which most people haven't really learned as much that we exist and can offer great support to your healthcare as primary care doctors for those people that are looking for more natural means as therapeutics. I'm also an integrative medicine researcher, so I love digging into the evidence and finding ways that we can integrate the latest new research into biomedical and healthcare. So very excited to join you guys.
Well, it's great to have you. And finally, we have Devon Klauck, lead nurse practitioner at online female health platform TIA. Devon, do you want to introduce yourself?
Hi, everybody. Thank you so much for joining today. I'm really excited to be here. I'm a women's health nurse practitioner. I see patients virtually and in person at TIA Clinic in New York City. And birth control is something I spend a lot of time talking about with my patients. So I'm excited to talk about it here today.
Share the wisdom, absolutely. No, I'm excited. So we will kick off in a minute with some birth control related questions, which is why you're all here. But for anyone watching at home, please do feel free to drop any questions in the Q&A function throughout today's conversation, and we'll do our best to answer some of those at the end. So first things first, I'll ask you, Dr. Revée, with so many birth control options out there, where do you start when considering what kind of contraception is right?
Yeah, that's a great question. And I start with my patients by first asking, do you want short-term or long-term? Because that's an important conversation. Are you looking to get pregnant in the future, or have you already made that decision that children is not something you want to add to your lifestyle in that particular way? I think we also need to consider, do you want a hormonal option or a non-hormonal option? And then also considering, what are the side effects of it and how that might impact either current medical conditions, current medications you might be taking, or even just in the future, if there's certain lifestyles that you want to live, there's certain birth control options that fit better lifestyles than others. So those are some of the other initial questions we ask. Also, ease of compliance. How easy is it for you to do this birth control? Certainly if you can't remember a pill every day, then that's not going to be the best option for you. So those are the initial questions we like to dive into. And then from there, we have a further conversation.
Yeah, absolutely. I mean, yeah, it's not an easy decision to make. I was going to say, aside from any of those, what are the questions we should be asking our medical practitioners to make sure that we feel kind of really comfortable with the decision we've made? Devon, what sort of things would you be kind of speaking to about with your patients?
Well, I think the basics are first going to be how effective is it? How well does it work at preventing pregnancy? What are the most common side effects? Aside from that, what, I like to tell my patients kind of what the more common experiences seem to be, because a lot of the side effects listed in the drug information doesn't necessarily contain everything that I hear back from people. So I think kind of what the typical experience is, how long does this method of contraception last? Are there any risks to my health or my future health? But really, I think it's appropriate to ask any question that you have. And if you think you might not remember them, write them down. There's really no limit to the questions you should be able to get answered before you choose what's the best method for you.
Yeah, absolutely. It's good because your questions tie in with a lot of my questions that I'm going to ask you today. So at least we are very much on the right track. So talking of that, I was going to ask any of you really about effectiveness. So, I mean, it's obviously the fundamental thing that people want to know when looking for birth control is how effective is it going to be? So what is the most effective form of contraception? And also what kinds of things can impact how effective they can be? Because there's the typical use and the perfect use with a lot of them. So talk us through that, please. Anyone?
Yeah, like you said, there's perfect use and typical use, or I like to call it human use, because there's not ever really going to be anyone that's perfect all the time. We in medicine kind of rank the methods in tiers. That's how the CDC does it, based on their percentage of effectiveness. So at the very top, first tier, most effective, over 99% effective, you're going to have permanent birth control, which is sterilization, requires surgery, and long-acting reversible, meaning non-permanent contraception. So that's going to be your intrauterine device, the IUD. There's a hormonal version and a non-hormonal, and the contraceptive implant. So the IUD is a little plastic kind of T-shaped device. It just sits inside the uterus. The implant is a small little rod that sits under the skin in the upper arm. Those are all over 99% effective. That's tier 1. Then you have tier 2, which is between, I believe it's 88 and 94% effective. That's going to be the pill, your patch, ring, the contraceptive injection, diaphragms. And then tier 3 are going to be 82% effective or less. That's going to include male and female condoms, withdrawal, spermicide, and the sponge. Technically, tier 3 currently via the CDC includes the fertility awareness method, but the range of efficacy with that is really wide. It's really about 77 to 98%, depending on what methods you're using, because there are so many natural methods to track your own fertility.
So there I can add that also in the CDC, they exclude natural cycles for that, because natural cycles is actually tier 2, so more in the range of the pill. So natural cycles is 93% effective with typical use and 98% effective with perfect use. And for natural cycles, a perfect user means that the user actually uses protection on the days the app tells them that they're fertile. So we call that the red days. So that means that they do use a condom or abstain on those red days.
So I guess you have to account for the fact that condoms then aren't always necessarily, I mean, they're one of the lower tier, aren't they? So yeah.
Exactly. So the perfect use of condom is 98%. So the same as natural cycles, because that is what women use on those red days. But the typical use of condoms is usually quite low, so lower than using natural cycles, because people tend to skip them. So that's why it's quite powerful to know when you're fertile or not, because then you know that actually this time we should not skip the condom, because now it's important to use it.
Yeah, absolutely. Some of the kind of more effective ones that you spoke about there, Devon, seem to be some of the slightly more invasive ones. what would you say to a person kind of contemplating getting that kind of birth control who was a bit nervous about the procedure, or whether they wanted to do something kind of that bit more semi-permanent?
So yes, they are more invasive as far as you need to have a procedure in your provider's office instead of picking up a prescription. So they're both non-surgical. However, the IUD is inserted through the cervix into the uterus. The implant is just inserted through a small puncture under the skin in the upper arm. So they're not, the most comfortable things. There's some discomfort involved with the IUD. It's primarily cramping, but it is something that works long-term without having to do anything. So a lot of people consider that kind of a trade-off. You go in, you have a crampy afternoon on the couch in front of the TV, and then you've got birth control for 3 to 10 years. But it's certainly not for everyone, and there are kind of tier 2 or intermediate methods that many people are more comfortable with.
Yeah. So, Dr. Ray, talk us through some of the natural methods of contraception. What would your kind of expert advice be on the pull-out method or the rhythm method? Are those advisable?
I think it depends. Some people it might not be advisable in. And as we mentioned before, with the fertility awareness method or the rhythm method, that's when you're tracking your cycle, so you can figure out when are you most fertile, and you're trying to avoid having sex or either using an additional form of barrier birth control like a condom in order to prevent pregnancy. Natural Cycles, that's part of where you can do fertility awareness for that tracking app. There's others too, but again, that's probably going to put you in the higher percentage is when you have something that's able to help you stay on track, be able to not falter each day, remember to do different little tasks like taking your temperature, notating what symptoms you're feeling that day. It will certainly increase your efficacy rate. But on average, I mean, I think you have to determine what might be better for you. If you're someone who gets caught up, because that's real, then, the pull-out method and the fertility awareness method might not be the best option for you. And that's something to be said about, when you're feeling impassioned and in the moment, it can happen. So you really want to make sure you have those fail-safes, or be a very disciplined personality if you're going to do that. I've known patients who have used a combination of those methods, both fertility awareness method and pull out, and have been pregnancy free for years, and they swear by it. Versus I've definitely had the experience of having people come in the office that, oh, well, I thought I was tracking, I thought I wasn't fertile. And I'm like, well, that's something else to keep in mind, is that your body can shift on you. So, right when you think sometimes you have it figured out, every once in a while, you might ovulate a little earlier. So that's where also bringing on board like ovulation predictor kits in order to see exactly where you're at, not just looking at cervical mucus, not just testing your temperature, but really making sure, oh, okay, I may have ovulated a little earlier this time, or I'm ovulating a little later this time, because that can be that window that can allow for lack of efficacy. And then, of course, the one that's 100% effective and natural is you just don't have sex. So that's not going to happen for some, but I mean, again, for certain people and whatever lifestyle they're living, if you don't want any hormones, don't want any birth control at all, you can just be 100% abstinent. Although we all know that's not the most sustainable in our societies.
And that's foolproof. Some of the new research from Natural Cycles, I was looking at it, found 86% of women had suffered unwanted side effects from hormonal contraception, and almost half of women had persevered for several years despite these symptoms. Elina, why do you think it is that women are persevering if they're not really getting on with it?
Well, I think even though there are a lot of birth control options, I think there's still not enough options out there, because when it comes to birth control, it's really not one size fits all, and women are different, and they go through different life stages, and different methods might fit them at different point in those life stages. So I do think we need to find more solutions and also spread awareness around those solutions, because I do think many women, and also I get to talk to many women in my job, of course, they feel like there's not many options for them. Like they often feel like it's either hormonal contraception or the condom, and maybe their partner doesn't want to use a condom all the time. So then they're left with that, and they have to feel bad for a long time.
Yeah, absolutely. Yeah, I mean, yeah, so much to think about, isn't it? Devon, if you could talk us through a little bit about the sort of side effects that you might expect from a range of hormonal birth control. And I know these can differ, but how can you tell kind of what's normal and what's just settling in, and when you should start to be a bit concerned that maybe this contraception just isn't the right one for you?
Sure, yeah. I mean, with hormonal birth control, unfortunately, there are a lot of side effects. Most commonly, headaches, fatigue, breast tenderness, nausea, mood changes. Most people don't experience all of those, but I would say most people do experience at least one or two, especially in the beginning. And they tend to improve over the first few months of use, but not always. And I think it's important going in that you kind of know what the more common side effects are. Your provider should be able to talk about ways to kind of help minimize those side effects. With the IUD or the implant, you can also have side effects related to the procedure, soreness, cramping. So there's certainly a wide range of quote unquote normal side effects, but there's also some warning signs of things that could be going actually wrong, mainly chest pain, if you're having shortness of breath, a really severe headache, leg pain. Those could be signs of either a blood clot or an ectopic pregnancy, and you want to talk to your provider right away. But really just if there's anything going on that you're not sure, is this normal, is this not normal, just check in with your provider. And the side effects as well, you don't have to just sit with them. So if you feel like this is too much, this is not tolerable for me, it's not working, just schedule another visit or virtual visit to talk about it with your provider, because there are other options, and you don't just have to live with whatever side effect comes along with the method that you initially picked.
Yeah, I think that's a really important point, isn't it? Because women are sort of taught that it's normal to be in pain every month with your period, and it's normal to be a bit uncomfortable with this and that. And I think, you know, I hope people listening at home are kind of remember that actually, if they feel that things aren't normal, then it's always the right thing to do to reach out and check.
Yeah, exactly. And I think also, you know, there can be some benefits to the hormone, obviously contraception, but aside from that, sometimes acne might clear up, or it might help with headaches that you're having before your period, or mood changes you're having before your period. So usually we can talk, and I usually schedule a follow-up about 3 months after starting a hormonal method to talk about the side effects that you're having, any benefits you're having. And usually we can find a balance between benefit and negative side effects with, you know, there's no perfect hormonal birth control, unfortunately, but it's worth having multiple discussions about.
Yeah, that's good to know it's not all doom and gloom, is it? There are some benefits. So Dr. Ray, thinking about kind of myths that surround birth control, I think one of them is around weight. So not only about kind of putting on weight as a result of some birth control, you know, is that to be expected or whatever, but also can weight impact what forms of contraception work for you?
Yeah, so it's one of those questions where it does depend on the situation and the person. I think sometimes when people initially look at that information or speak to their doctors, they'll tell you like, oh no, the birth control pill doesn't cause weight gain, or no, you know, you're fine. But for some, we now know that there are some instances where potentially the way that estrogen and progesterone is interacting also with our brain and our adrenals, and activating which we call the HPA axis, or the hypothalamus pituitary adrenal axis. That communication and those feedback can sometimes activate certain genes. And in fact, I think there was just a recent study that came out that actually is starting to look closer into that there might be some people with certain genetics where they might be susceptible to weight gain. But on average, most people, there might be some additional water retention of 3 to 5 pounds, but not much. Sometimes that can come again from, the hormones. And then also just keep in mind too, lifestyle behaviors. When we've started birth control at one period of our life, let's say if you're starting, you're younger and then you've been continuously taking it, so if you started at 16 and now you're 25, well, there's natural weight changes that can happen anyway for women. So it's also just making sure that, and men for that matter, but specifically in the case of hormonal birth control women, making sure that we're knowing our bodies. That's where it helps to step in, is knowing your body, know how your body feels, being aware of your nutrition, your exercise, your stress, because even stress can play a role in it. It might not be the birth control, it might be stress and other factors going on. In cases of morbid obesity, sometimes it can be difficult for hormonal birth control to be as effective. Some of that relates to when we have extra fat cells, we do produce sometimes more estrogen as a unfortunate side effect of that, but not always. So really, I can't say that it's this one black or white answer as we're starting to recognize with hormonal birth control and birth control in general. I think it's one of those situations where it just takes mindfulness, being aware of where you are, what you're doing, what's impacting you. And if for whatever reason, if you do happen to feel that your birth control, for example, I did have one patient where the depo shot, definitely she gained 15 pounds within several months. And she previously she exercised and she still continued to exercise. She still was eating well. So that was an example of all right, well, clearly this is one of the side effects for you. And when we did transition her into a different form, she was able to lose that weight. And she swears up and down, she's like, that shot made me gain weight. So I think there's something to be said of, don't always feel dismissed just because you might not see it in the literature, or just because when you first initially bring it up with your doctor, they say, oh no, don't worry about it. I think just pay attention, be mindful. And if it really does start to be one of those things where maybe it is impacting that HPA axis, like I said, to where that can produce a little bit more cortisol, because cortisol can relate to gaining a little bit more weight, or even the communication between the brain and your ovaries and things like that, can throw off. Maybe they say it doesn't have a relation to your appetite, like ghrelin and leptin. Those are the hormones that manage it for satiety and appetite. But again, there has been some reports where people will say, I do have an increased appetite, or I do have a decreased appetite. So yeah, sorry I didn't give it the most, again, not a black and white answer, but I think that gives you a lot of insight as to how it can be variable, quite frankly.
Yeah, it shows also that it's not just a complete myth. There is, there's
no, it's not. It's not.
Yeah, I agree, Dr. A, completely. I think there's not really any large body of evidence directly connecting hormonal birth control with weight gain, but we know that hormones and the natural fluctuation of our hormones, which gets shut down with the birth control pill, affects so many different things in our bodies and our brains. And I don't think there's really enough research that's been done to really definitively say this doesn't affect your weight. And I also see people every day that they tell me, I gained 5 pounds as soon as I started the pill, and I stopped, it came off. I do think there is some significant evidence for the depo shot causing weight gain in adolescents. I think that's one of the studies that did find some kind of direct connection.
Yeah, it's good that there's kind of research going on, because I think, women care about it. That's an aspect that we really do care about, and it's a valid one. Let's talk about STIs and birth control, because it might feel like an obvious thing, but actually sometimes it's really useful to just kind of go back to basics and talk about which contraception actually protects against STIs, and what are the most important things that we need to remember about having safe sex. Dr. Revée?
Yes, so the barrier methods, condoms, whether it's male condom, female condom, dental dams, things like that. That's what we know to protect against sexual transmitted infections. Of course, like I said, abstinence, not engaging at all. But something to also note, and this is something that I don't think many people understand, is that certain sexually transmitted infections, such as the human papillomavirus, HPV, or herpes simplex, they're more skin-related viruses. They can embed in the skin, so that contact, even with a condom on, that contact and that friction that's happening. Sorry to show the example, but sometimes I feel like you have to like dive it in, like, yeah, there's friction, there's some belly rubbing, you know, and going on. So in that regards, those particular types of infections can actually still transmit, although, you know, it's not as high as when there's actual body fluids involved. But definitely, if there is any type of sores, and maybe the pubic hair is covering it up, or warts, maybe pubic hair is covering up and you can't see it, to be mindful of that, because that can lead to the external genitals or the external skin tissues being affected, where the condom doesn't even cover those parts.
Yeah, and I would also just take a moment to plug the HPV vaccine, because
Right.
that's really the best way to prevent cervical cancer. And like Dr. Revée said, it's very difficult to prevent transmission of HPV. So get the vaccine, get it early, boys and girls.
Absolutely, yeah. In the UK, it's now in boys and girls in schools. So yeah, it's important for people to kind of learn more about that one. Let's talk about kind of the duration that people are on birth control for. I mean, the natural cycles data that's just recently been released showed that 1 in 4 women have used hormonal contraception for over 10 years. So can this impact our fertility? Should we be worried? Should we be having a break to see kind of what's going on in there underneath all the hormones? Or what would be the advice? That's anyone who's interested in answering that.
Well, we have quite a lot of data on this, because you can also use natural cycles to plan a pregnancy. And we then follow them and see how quickly do they get pregnant, do they have reduced fertility, what is their time to pregnancy. And it's quite clear that coming off hormonal birth control can slow down your time to pregnancy up to a year. But the good news is that after that year, you have the same chance as everyone else. So your long-term fertility doesn't seem to be affected, at least not as it seems in our data. So that's good. But I think then if you don't want to have it delayed, it's good to stop hormonal birth control a little bit early to indeed get your body, you know, jump started and make it work again and start ovulating again. Because we also see that if you start planning a pregnancy directly after using hormonal contraception, compared to if you used natural cycles before, you do get pregnant 60% faster. So I think it depends how quickly do you want to get pregnant.
Yeah, that's actually one of the questions I get asked most frequently. And I think that natural cycles is such a great way to kind of either prevent pregnancy in general, but also if you kind of want to transition off the hormonal, then you're not quite ready to get pregnant, you're following your cycles, you're really kind of learning how to time intercourse to get pregnant through using that app. Something else that I talk about with my patients is that there's not any sort of direct connection with hormonal birth control and reducing fertility, aside from, you know, delaying fertility until you return to your normal cycles. But while you're on hormonal birth control, you could be masking symptoms that might be red flags in terms of your fertility. So you may, you know, let's say you're not ovulating, you're not getting your period. You may not know that if you've been on hormonal birth control for 10 years. And the other thing is just time is passing too. So I think, you know, people ask me if I'm on birth control for 10 years, is that going to affect my fertility? probably not, except that you're going to be 10 years older, and age is the most important factor when it comes to fertility, unfortunately.
Absolutely. I totally agree, Devon. And something I wanted to add on to this as well is just being mindful that there are certain forms of birth control where, things return a little faster than others. For example, the pill can happen going off the pill, you can get pregnant, within that month, or within a few months versus stopping the depot shot. It might take anywhere between 3 months to over a year before things get back to normal. And then something else I like to work with. So in my practice, I actually see a lot of women that are coming to me that have just stopped birth control and are finding that it's having a challenging time getting their cycles back on track and feeling better in their body and wanting support in that preconception health. So I definitely want to put the plug in that preconception health starts early. This myth of, I want to bust that myth of just, when you're ready to get pregnant, just get pregnant. Unfortunately, we live in a very different world than our mothers and our grandmothers. We're also being assaulted on a daily basis with endocrine disruptors. That means there are substances and compounds in our environment and immediately around us, even in our water and our foods, that can actually impact our hormones. So even beyond just getting off the hormonal birth control, you have to keep that in mind. What other ways, just like Devon said, that may have been masking already a hormone imbalance. And also, when you are coming off of hormonal contraception, one of the things I work on with people is optimizing their liver phase 1, phase 2 metabolism pathways. What that means is our liver helps us to clear out toxins, clear our hormones, help our body to just cleanse itself and maintain proper function. So coming off of any medication for that matter, it does put an extra little burden on the liver, and we like to optimize that detoxification pathway. And then also I like to optimize their gut health because a lot of people don't realize that your gut does also play a role in deciding which hormones recirculate back into your bloodstream, your body, versus what hormones you eliminate out. And making sure you have healthy microflora and a good gut health is going to shorten that time period for you to be able to get your hormones back on track.
Yeah, I think it's really important to have this kind of conversation because we're always told from so young that don't get pregnant, and I think there is kind of this assumption then the moment that you come off birth control that it's just going to happen like that. And I think it's really good to kind of be more informed because your expectations are going to be realistic in that way. So moving on to the future of contraception. I mean, this one's kind of open to anyone. Why is it, do you think, women are beginning to sort of step away from traditional hormonal methods of birth control?
Well, I think just in general, women are becoming more aware that they have more options. The pill was revolutionary in the 60s when it came out, and it really was the doorway to freedom for a lot of women. But thankfully we've progressed, we've moved on from there. And there, I think, is kind of a trend or a movement now into women being more aware of the options that they have, more aware of their body processes and the importance of ovulation, aside from just being able to conceive. And my hope and the goal that we have at TIA is that the healthcare community is also beginning to take on more of a responsibility for providing person-centered care, individualized care that really addresses the person as a whole and not just as someone who doesn't want to get pregnant.
Yeah, absolutely. Elina, I was going to ask you, obviously, I mean, it's technology is kind of how you've made such strides kind of for female healthcare. So what is the benefit of technology when it comes to contraception, and how do you think technology's role will continue to evolve in future?
Well, I think in general, using technology and data to give insights when it comes to your body and health, it can be very powerful. And I think that's also what Devon just touched upon, that, women are becoming more and more empowered by knowledge, both about like how their bodies work, but also how like external things affect it, like, you know, the side effects of hormonal contraception. They're looking for other options. So with Natural Cycles algorithm, taking the old method of analyzing women's body temperature by hand, which wasn't very effective or easy to use, technology and algorithms can help that and make it both effective and easy to use, which makes a big difference when it comes to birth control, because these are like the two most important things. And I think this is really just the beginning of that. And I hope the more we are able to collect data on our bodies, and the more we will be able to advance technology, the smarter we can become and, you know, take more informed decisions when it comes to our health with the help of technology. So I think we'll just see more and more of that.
Yeah, I think it's exciting for the future, isn't it? Of yeah, taking it into our hands a little bit more. How far are we? I mean, this conversation really has made it so even more kind of obvious how much of a female problem or consideration, not necessarily a problem, birth control is. How far away are we from contraception kind of becoming more equally a male and female consideration? And maybe an obvious question, but why do you think it's been taking so long for this to happen? Devon?
I think, you know, we've come a ways, we've made progress in some ways, but sadly, I do feel like we're fairly far away still from contraception being a more equitable consideration. We certainly need more healthcare dollars spent on research, specifically for options that male contraception options. I think also, you know, we joke a lot in my field that if men could become pregnant, we would have a lot of options for males. And it's not completely a joke, because it is, I think, because women carry pregnancies, I think we bear such a large part of the responsibility of preventing that pregnancy. So it really has to be a shift in the mindset of society, that contraception is really, you know, not just a her issue, it's a we issue. Everyone needs to be focused on advancing that area of medicine and technology.
Yeah, absolutely. Yeah, hopefully, I mean, it'll continue to evolve, won't it? So we're coming near to the end of the main section now, but I just wanted to ask all three of you, sorry, if you were to give kind of one key piece of advice to a woman about birth control, what would it be? Elina, we'll start with you.
Well, I think also here, knowledge is key and knowledge is power. So I think reading up on both the effectiveness of each method, the potential side effects, the pros and cons, and really take an informed decision is important. And really like read the science of it, the trusted sources, and not so much, you know, the gossip online, which can be hard with any topic today.
Absolutely. And I would say mindfulness. I can't tell you how often that when I'm working with patients, there isn't as much of mindfulness around your body. How does it work? What are your symptoms naturally throughout the month? What does that look like? And so I think really having women take charge, be empowered, know your body. Know what happens in your body. You are the expert of your body. Don't ever let anyone make you feel as if you don't know your body. Stand on that so you can be your own best advocate.
Yeah, absolutely. And I think for me, what I tell my patients all the time is the best method of contraception is a really personal choice. And what might be right for your mom or your sister or your best friend, it's not necessarily what's right for you. It might not even be what's right for them if they haven't had the opportunity to become educated and aware of the different options. So you really want to know all of your options, know what your priorities are. So what is most important to you in choosing a method, and then know that you always have a choice. So if you feel dissatisfied with the choice that you've made, or your circumstances change, you can always make a change. And just, I mentioned this before, but don't be afraid to ask questions. Ask as many questions as you need to, do as much research as you need to feel confident in the choice that you're making.
Yeah, absolutely, definitely. We all need to be kind of brave enough to ask. I'll do one final question for you all before we go into the Q&A. Just if there's one kind of misconception that you feel there is that you feel would be really, it would be really useful to kind of bust that myth. Anything come to mind for the three of you?
Yes, for me, I hear a lot. I'm really interested in the IUD, but I've heard horror stories. I hear that sentence every day. So, you know, it's certainly not for everyone, but it is a really great method, especially if you want the most effective at preventing pregnancy. And it's, you know, like I said, there's some cramping involved, but overall it's an in-office procedure, very safe, very tolerable. We actually do it with acupuncture at TIA, which we found to be really helpful with discomfort and fear and anxiety. But there are so many really scary stories out there on the internet, and I think that those blogs and forums have scared a lot of people off that may have, you know, really liked it or really benefited from it.
Yeah, absolutely. Elina?
For us, we hear a lot like, is natural cycles the same as the rhythm method? Which is definitely not. And we've performed clinical studies ourselves, but also there's been other clinical studies that show that the effectiveness is very, very different. And the main reason for that is like guessing when you ovulate and assuming that you ovulate in the middle of your cycle versus actually detecting ovulation and having proper algorithm assess for your cycle when you ovulate and not based on other women makes a very big difference in that. And then also in general, knowing that, well, except complete abstention, there's always a risk of pregnancy with every birth control method is something that's maybe obvious, but it seems to me like people often forget. So it's just good to be aware that there will always be a risk of pregnancy with whatever birth control method.
Yeah, that's definitely wise to know. And also that was one of the difference between the rhythm method and natural cycles was one of the Q&As. So you've hit that one on the head. Dr. Ray?
Yes, what I get is sometimes people think that natural forms of birth control or non-hormonal forms of birth control are better. And that's not true. Like we just said in this whole conversation, it depends on what your needs are. It depends on what your goals are. It depends on, you know, your body. And so it isn't this thing about, well, all hormonal birth control is just bad for the body and you shouldn't, you know, entertain it and use it at all. It's awful. Keep an open mind. I always tell people as a naturopathic doctor, you know, I'm not anti-drugs. I'm not anti-pharmaceuticals. I'm not anti-anything. You know what I mean? It's all about integration and education. So just make sure you educate yourself on your options. And if you don't want any form of hormonal birth control, then know that there's options available for you, but you don't have to necessarily believe that hormonal forms of birth control are the devil, essentially.
Yeah, I think that's one thing that's really come out of today is that there's just so many things to consider, and it's not a one size fits all, is it? It's what's right for you. And I think just having the power to kind of educate yourself, inform yourself and make that decision is really kind of the most overpowering message. So yeah, I think that's been really interesting. I will move on to some of the Q&A questions we've had in. So the first one is touching on kind of the whole male contraception thing, which obviously we discussed a little bit earlier, but I thought this was a really interesting question. It was, how can, you know, until we get to the stage that there is male contraception, you know, in as much abundance as there is female, what can both women and men do to ensure that the burden of contraception is more equitably distributed?
So with natural cycles, we like to think of it as a actually more gender equal method, because the women, they measure their temperature and, you know, figure out when they're fertile or not. And then when they are fertile, it's actually the man who has to use protection with, you know, usually a condom. So we like to think of it of actually being more equal, and also hopefully educate the partner also about her cycle and how her body works, which sometimes the education there can be a bit too low.
Yeah, I agree. And I think we have to also just remove the stigma around just menstruation and female reproductive health in general. I think a lot of us growing up, and still even now, birth control is a secret, having your periods a secret. You know, you want to be, you don't want to get pregnant, but you don't necessarily want to talk about how you're not getting pregnant. And I think that we really have to move towards having reproductive health be something that we talk about, like cardiac health, or, you know, blood pressure, or any other type of indicator of wellness.
And I would like to add, you know, your partner should want to invest in knowing your body and how that impacts you, because that impacts your partner as well. So really push back and give accountability. Like, no, you should know where I'm at, how I feel in my body. Just like, you know, you probably, most of us women, we extend that compassion to want to know what's happening in their bodies. What I like about natural cycles, and I always mention this to my patients, is that you can have your partner download the app too and be able to follow along with you. That's something that I've done personally. That's something that I've had other patients do. And sometimes it also helps take that guesswork out. So you're not always the one that's communicating, this is where I'm at, this is how I feel. It's one way that you can bring on accountability for your partner to also check, like, oh, you know, she's on a green day or she's on a red day. I'm not going to, you know, really bark up that tree unless I know I'm prepared to step up and do my part. So just make sure you two are having these conversations. It's not you to talk about vaginal issues or your reproductive issues. I think that's one of the biggest things. Men are like, ew. I'm like, no, grow up, be mature. And that's what you want in a partner as well. Someone who's evolved and mature to carry that, to walk through this journey with you, because it's just as much yours as it is that person too.
Yeah, absolutely. Yeah, the person that asked the question sort of said what would be a good way to educate men on this topic. And I think all of those things are exactly, it's opening those lines of conversation, you know, not making it stigmatized, making it both of your problems and giving them all the tools, you know, to follow along if that's what works for you. So yeah, I think, thank you. That's a really useful answer. The next question is about, is there a minimum age you would advise for any hormonal treatment? So this woman was thinking of taking her 15-year-old niece to look into contraception options, but wasn't sure if that's the right time. So yeah, any advice on that?
I think it's tricky. Your hormones change so much in adolescence that you tend to want to avoid introducing synthetic hormones into that process. But it's, you know, much more, unplanned pregnancy is much more risky to the health of any female, especially young females. And so I think it's really a conversation that needs to be had with your teenager, with your provider, with the parent. I think transparency and openness is really important, and it may be that the benefits of hormonal contraception is going to be outweighing, you know, kind of the side effects that they may experience, but it's something you also want to check in with continuously. So let's not start them on the pill when they're 15 and then they stay on it till they're 35. You know, let's check in a few years and see if circumstances have changed, if maybe there's a method that might work better.
Yeah, absolutely. I've had another question, which is about access to birth control. So obviously, I mean, that's going to be different from territory to territory. But what over-the-counter options are available?
Of course, there's condoms. That's available. That's pretty straightforward. Dental dams, things like that. Additionally, it's being able to access the apps, right? The app to be able to download, that's readily available on your phone. Most people's smartphone, once you have the ability to get that. Over the counter though, I mean, I think, spermicides, that's the other thing, although I'm not the biggest fan of spermicides by itself. What do you think, Devon? What are some of the things that you guys recommend?
Yeah, here in the US, there's not a lot of options aside from barrier methods like condoms. Emergency contraception, which I don't recommend relying on, is available over the counter. You do have to ask for it, but you can get that in the pharmacy over the counter. I know in other countries the pill is available over the counter, but here it's not. There's not a lot of options. You know, of course, there's Planned Parenthood, there's places for people with limited resources, underinsured, uninsured patients can go to still have access to prescribed birth control.
So Natural Cycles in the US is the most effective over-the-counter birth control method. So especially like during Corona times, and if people have limited access, that can really help, at least as a temporary solution.
Yeah, absolutely. So yeah, I suppose with it being different wherever you live, kind of just speak to your healthcare provider and see kind of what's available for you. We've got one final question, which is quite an open one. But how do you envisage the future of birth control? We'll ask all of you.
Well, after recommending Natural Cycles to my patients and hearing Elina talk today, I do think tech is going to be a big part of it. I picture kind of this, kind of in a lot of ways, this kind of just connection between technology and our bodies and being aware, and maybe eventually there will be a method that can kind of just kick in when you're ovulating, or something we haven't even really thought of yet. But I think technology and biometrics are going to be a big part of where we go.
Yeah, I obviously think so too. And as I mentioned, I think we're just at the start of this innovation, and there's a lot more to be done.
I'm really excited to see what AI brings, because we really haven't even touched the tip of the surface with machine learning and AI and how we can apply it to the human body. With Natural Cycles, you're beginning to gather that data. The more data we're able to get on our bodies, on our health in a more expansive way than ever before, I think that's really going to, again, allow tech and AI to come in a different way. But then also with the new research that we're continuously to have, you never know. I mean, we might continue to find something in nature. Again, I mean, the birth control did derive from wild yams, so who knows what else we might continue to find that hasn't been discovered yet, an herb, a plant, a root, something that as well can maybe finally offer a natural, even more natural form of birth control that some people are looking for. So it seems pretty exciting.
Well, thank you. And somehow we have come to the end of our conversation. I'm not sure, it's kind of gone by in a flash, but thank you so much to everyone who's joined us today for this virtual panel on unpacking birth control in 2020. I hope we successfully unpacked birth control in 2020 for you. And I hope you've all come away kind of having learned something that you might not have known before, because I feel like I'm richer in knowledge. Thanks again to our brilliant panelists. I'm Kat Harvey-Jenner from Cosmopolitan UK, and it's been an absolute pleasure. Enjoy your rest of your days, everybody.
Bye. Thank you, everyone.
Thanks. Bye.
Thank you. Bye.